851-5358. Hello Gorgeous is conveniently located in the heart of downtown Ocala, right next to the historic Marion Theater. And don't forget, we also do men and children's cuts too.
Hello Gorgeous.
All right, 10 minutes before 10 o'clock. Nice looking Thursday. It's better looking than it was. Actually, it's a little overcast looking. It's getting better looking, though.
I like it.
It's a habit of mine. When you have 300 nice days of weather a year, according to the Chamber of Commerce, you get in the habit of saying it's another nice morning. In today's case, it was a little rainy. But we need the rain, right?
We do need it.
Dr. Antonello Tony Punturieri is on the phone. He's the program director in the Division of Lung Diseases at the National Heart, Lung, and Blood Institute at the National Institutes of Health. And it's an honor to have him on our show. He's talking to us about the first ever chronic obstructive pulmonary disease action plan, how patients and health providers can work better together, and how awareness can be raised about COPD in communities. And that's the part of this that we do. Radio is about communicating and spreading the word that that is important to know. This is one of those cases. Dr. Punturieri, good morning, sir. What an honor.
Well, my pleasure. And first of all, you're doing a wonderful job with my first name and last names, but please just call me Tony.
Okay.
Let's go ahead.
Well, thank you for that. I'm only doing a good job because I'm looking at it. I don't know that I'm doing it right, but thank you for the compliment. Where are you calling from?
I am calling from the National Heart, Lung, and Blood Institute in Bethesda, Maryland.
Oh, okay, in Bethesda. Well, thank you for being on the air with us today. Yeah, the heart, the lungs, you don't want to mess with those two organs. I guess you don't want to mess with any of them, but those two seem to be pretty important to our health.
Yeah, you need to breathe oxygen and to pump blood around. Those are pretty fundamental.
What does the word obstructive refer to in this particular disease?
Well, again, another mouthful in this case. Chronic obstructive pulmonary disease, that's why we call it for short COPD, is a progressive chronic, as the word says, lung disease that takes your breath away. And since we were talking about oxygen, basically that's exactly what it is. You are less and less capable of delivering oxygen to your body. So in very lay terms, you end up suffocating.
And what's caused the obstruction?
Well, it's a mixture. The COPD is actually an umbrella term that describes the two parts of the disease. Some parts are related to the obstruction, as you're mentioning, that is the pipes that are conducting the air from your nose and mouth down to the lungs.
Uh-huh.
They get inflamed. They get obstructive. Sometimes they grow in weird ways, and so air can go easily in and out, as in normal lungs, and that leads to one bad thing in COPD that is called air entrapment. In other words, you breathe in, but it can't go out. Of course, that's not good.
Does the humidity of an area make a difference? In other words, if somebody has it, let's say here in Florida where it's very humid, would they be better off living in a more drier place like Arizona, I guess?
The weather is important, and I'm explaining why. Not as much as for the chronicity of the disease, so for the long term, but for the flares. And in other words, pollution in the air, it's important. And people with COPD, unfortunately, have flare-up of the disease. These are called exacerbations. And exacerbation, yes, may be brought down by bugs like viruses. That's why it's important that people with COPD, for example, get vaccinated, especially with an influenza vaccine.
Yeah.
People.
But other points is that air pollution also can push toward an exacerbation, and that's why people need to monitor that and maybe prefer to stay indoors when the air pollution is high.
When people are diagnosed with COPD, sometimes the doctors say they can't do anything except prescribe that buterol for inhaler purposes. Why can't anything else be done?
Well, first of all, yes, that is probably one of the first drugs, but there's much more out there. A lot can be done about COPD. First of all, again, medication. There is a wide spectrum of medication. A lot of medications out there that improve. Definitely, one optimized to the patient because again, all COPD patients are different, and so the appropriate medication, the appropriate amount and dosing needs to be tailored to each patient. In addition to that, physical activity, promoting physical activity is definitely important for these patients. Hence, pulmonary rehabilitation is something that has to be recommended to COPD patients. And clearly, there are more invasive interventions down the line, and they go all the way to taking away some parts of the lungs, for example, through surgery, all the way to a total replacement with lung transplantation.
Oh my gosh! Oh wow! Does it ever lead to something more? It's pretty serious as it is, but does it ever lead to something more serious like lung cancer?
That's a very good question, actually. We have conducted research that shows that people that have COPD have a higher prevalence of lung cancer. Indeed, the two diseases unfortunately go along in many patients, and so we see this quite frequently. And this is also true after you consider the amount of smoking. So it's not totally dependent on the amount of cigarette smokes.
So the national. I was going to ask the National Action Plan, which is part of what we wanted to make sure to spread to the audience. Is that something that they get on a website? How do they get the information about the plan?
Well, the most important thing, as you mentioned, is that we have a national action plan. Against the staggering amount of people that die of the disease every year, the people that have the disease in the U.S., again, 60 million and more undiagnosed, and the amount of money that the whole nation spends on COPD, we are talking about total cost in 2010 of about $50 billion.
Wow.
There is this is what prompted Congress to ask NIH, my institute, NHLBI, and the Center for Disease Control in Atlanta to come together with all the stakeholders and deliver a blueprint so that we could keep the disease in check, we could make progress, we could make patients part of it, and help them recognize the disease and help a healthcare provider to deliver the appropriate treatments and diagnoses that are needed.
So would somebody who's already been living with COPD change the way they do things once they are familiar with the action plan?
Well, things are always flexible, of course. As I said, the disease in some people is stable, in some other people accelerates with time. And so a continuous open dialogue with the provider, it's the best thing to do to optimize care. In addition, the experience of every patient is important to empower all other patients. There's nothing better than communication among patients of what works for me, what works for you. Those are important points, and also stimulate another aspect that I didn't touch yet about the disease, that because of its nature, because of the fact that it makes you do less and less, it brings you to isolation. And so you isolate from the community, from society. And instead, this kind of interaction bring you back, of course. Isolation goes also hand in hand with falling into anxiety and depression,
I bet,
which are other common comorbid symptoms in COPD patients.
Let's leave the listeners with some information so they can get more information. What do you recommend, a website, or does the doctor have all of this information?
We hope that the doctors will have some of this information, and that's why the plan has to be implemented and with all the stakeholders participating. But right now, the best thing to do is to go to this website, copd.nih.gov. Again, I repeat, copd.nih.gov. At this website, not only people can see and download or print the National Action Plan, but they also can get information about the disease and way to help the National Action Plan to become a reality for everybody in the United States.
Very good. Dr. Tony Punturieri, thank you for being on the air with us and for the good work that you are doing. This is WOCA Ocala.
Fox News Radio, I'm Lillian Wu. Senators on the Intelligence Committee getting their chance to grill the former FBI director in his conversation with the president. James Comey in his prepared opening statement saying the president directly pushed him to lift the cloud of investigation into the probe in Russian election meddling.
Separately, Comey will also detail how he says the